This video aims to show the management of a patient in cardiac arrest with presumed Covid-19. This would be a 2222 call. The first responder has found a patient unresponsive with
Hello,
no
sir,
signs
you
of
all right?
life.
Sir, can you hear me? Are you okay? Can I have a hand, please? Linda, can you make an adult 2222 call, please, and come back with some equipment?
Yeah, we'll do.
Help has been summoned and the emergency call bell has been activated. Note, the first responder has not started CPR, but is exposing the chest and awaiting arrival of equipment.
In the room and the pads, the team's on the way.
Thank you.
The defibrillator can be applied to the chest, and if trained to do so and the patient found to be in a shockable rhythm, this rhythm can be treated appropriately without additional PPE. Outside the room, other members of the team are donning full PPE before entering.
Okay, it's a shockable rhythm I'm charging. And shocking.
Shock delivered.
Hi,
Jess, can you take over chest compressions, please?
The second responder has taken over chest compressions, with the first responder now exiting the room to apply PPE. The third responder, also wearing full PPE, can now support bag valve mask ventilations, working with the second responder. The bag valve mask is used in a two-person technique at a ratio of 30:2. If trained to do so, eye gels can be inserted with continuous ventilations and uninterrupted chest compressions once chest rise has been confirmed.
Yep, lovely.
With the first responder now in full PPE, we can work with the ALS algorithm,
Okay, are we at 2
analysing the rhythm every 2
Let's
minutes
stand clear
and
analyse
shocking
the
if
rhythm.
appropriate to do
Standing
so.
clear, we're in VF. Jess, can you return to the chest for charging, please? Got a closed circuit of oxygen. Jess, stand clear, shocking.
Shock delivered.
Super, if you can return to the chest, please.
Begin CPR.
Linda, are you happy with
Team
the airway?
leaders
Are you
should
happy
be
I've
ALS
confirmed
trained
I've got
and will
airway
work
to
through the
check
reversible
And if we
causes,
can get a
the
filter
4
pass
H's
into the room,
and the
please,
4
that would be
T's
great.
logically.
Jess, are you happy on the chest?
I'm all right at the moment, thank you.
Okay, so let's work through our reversible causes. Could somebody pass in a blood gas syringe, please, and some blood bottles? And we'll use those. Okay, so let's think about our reversible causes.
The cardiac arrest trolley is not brought into the room, but equipment can be passed into the room by supporting staff outside to aid the
Thank
resuscitation
you. Linda,
attempt.
there's the filter.
Lovely, thank
So
you.
we'll give some fluids. Is there any reason to think this gentleman might be hypovolemic? We'll take a blood gas. Let's take some routine bloods as well, please. And if we can get those sent off as soon as they're taken. Thank you, guys. So thinking about electrolyte abnormalities, we're thinking about our potassium and our reversible causes. We're thinking about hypothermia. He's not cold to the touch, so we're excluding hypothermia. Hypovolemia, we're dealing with some fluids. And hypoxia, Linda, you're managing that adequately. Jess, I think we're at 2 minutes. If we can stop and do another rhythm recognition.
Ensure
Still in
high
VF,
quality
please,
chest
back
compressions
onto the chest
continue
whilst
throughout,
charging. Back onto the
swapping
chest whilst
staff
charging.
in order to maintain gold standard chest compressions.
And stay clear for shocking, please. Shocking.
Shock delivered.
Thank you. Back onto the chest again.
If using the defibrillator in manual mode, ventricular tachycardia requires a
Super,
pulse
if you
check
could stop.
to ensure it is a pulseless
We've got
VT prior
on
to
the screen.
delivering a
Jess,
shock.
could you see if there's a palpable pulse at all?
Anything else? I can't feel a pulse.
And back on the chest, please, Linda, whilst I charge.
The cardiac arrest thereafter is managed as per standard ALS
Everybody else stand
algorithms.
clear. Jess, off the chest for shocking.
After the third shock, amiodarone 300 milligrams and adrenaline 1 in 10,000 1 milligram should be administered to the patient.
Thank you very much, team. If you could pass those in.
These drugs can be administered by opening the syringe, applying the adapter for glass syringe. These can then be administered IV or IO routes. For patients in a non-shockable cardiac arrest, asystole or PEA, adrenaline 1 milligram of 1 in 10,000 should be administered as soon as we have either IV or IO access established.